Hello there, fellow Fitjuists. I wanted to talk about diastasis recti. I feel like it's come up a lot recently with my own clients in a bunch of different groups on Facebook, and I feel like there's, for some reason, a lack of information, or really it's maybe just a lack of awareness out there, and it's something that's really, really important for us to know about, because any woman who is pregnant, who has been pregnant, has experienced diastasis recti, and if you are planning to get pregnant, then it's also something that you should know about. Super important. So I just want to take a few minutes to talk about it. With that said, I do want to say I'm not a professional in this field. God willing, I have my pre- and postnatal certification scheduled for February, so I'm really excited about that. But in the meantime, I am sharing with you information that I have from resources and information that is accessible to me. It's accessible to you as well. I will put in the comments below a couple of links that could be helpful for you. But I'm just going to sort of break it down in plain English so that you know what we're talking about and what's going on when people talk about it. So in a nutshell, what happens is as your skin expands and the uterus expands to make room for the growing fetus, the ab muscles expand as well. And basically between the two ab muscles, the left side and the right side, there's this connective tissue called linea alba that basically goes from the sternum to the pelvic bone, both sides of the muscle, and it sort of keeps everything together. It's this tight connective tissue. And that expands as well to make room for the growing fetus. But as it expands, it loosens, it weakens, right? Think of it as taffy. The more you stretch a taffy and the thinner that taffy gets, it doesn't rip, it doesn't tear, it's still one solid piece of taffy, but it doesn't have that same strength that it had before when it was a thicker piece. So when your ab muscles separate, that's what diastasis means. Your ab muscles separate, that connective tissue is thinner, and after birth, for a lot of women, it just goes back together, which is what we want. That connective tissue strengthens itself, but for a lot of women, up to a third of women actually have diastasis recti up to 12 months postpartum. And the reason that that's not good is because we want that connective tissue to be strong. That's in large part what gives us core strength. And without that, when that whole area is weak, we're going to compensate by using other muscles, which is overall just not good for us. So there are some really easy, simple exercises that you can do to tighten that connective tissue back up, bringing those muscles back together. For some people, they'll come all the way back together. For some people, won't. But either way, the more important part is to really tighten up and strengthen that connective tissue. Just from an aesthetic standpoint, and if you know me, you know that weight loss as a goal is not something that I promote, but a lot of women talk about having a really hard time losing that, that little bit of baby weight, and they sometimes feel like they look 3 months pregnant, 5 months pregnant, and often it's nothing to do with weight, and no amount of dieting or exercising for weight loss is going to help, because in fact it's diastasis recti where those muscles are pushed out and that skin is sort of just covering it up, and it looks like a little belly pooch that has nothing to do with fat or weight gain, but has to do with the fact that the connective tissue is loose, those muscles are pushed out, and just need to be tightened up. So please take note. There's a really easy way to check if you have diastasis recti, how severe it is. Again, I'm going to put a link in the post below. I highly, highly, highly recommend that you seek out a pelvic floor specialist postpartum around 6 weeks mark, just to make sure that everything's functioning okay and that everything is as it should be. And again, she will be able to help guide you with exercises if necessary. If you have any other questions, feel free to comment below or shoot me a PM. I am happy to answer to the best of my ability. And if I don't have the answer, I will hopefully be able to direct you to someone who does have that answer for you. Have a great day. Well, evening.